We're going to go over some of the corticosteroids. Now, with these corticosteroids, there are two classes that are used as your anti-inflammatories. You've got your leukotriene inhibitors and your corticosteroids. In the pre-hospital setting, usually we're not going to be dealing with your leukotriene inhibitors. That's going to be more long-term treatment, home med type things. But either way, so this drug class is used to reduce and control that inflammatory response. Now, most of what we're looking at is with asthma, but you will also see this with your allergic reactions as well, because in the respiratory component of that. Now, these are going to have a prolonged effect, much more so than your bronchodilators as far as that inflammatory response. Now, your steroids and the acute asthmatics are going to be used when your bronchodilators are not completely relieving or maintaining control, because they're going to add that inflammatory response inhibition on top of the bronchodilation itself. Because remember, asthma, this is a two-part problem. We've got the inflammatory and the obstructive, the bronchoconstriction as well. So we're working on that other side of it now. Okay. This, a lot of times, if it's a home steroid use, will actually allow for the reduction in your dosages for your bronchodilators. During an acute attack, we are going to give it usually parenterally. Now, it can be given orally, but we're usually going to be doing the parenteral route to achieve these drug levels very rapidly, to get the effective level in the body and working. Prednisone is one that's commonly used. Dexamethasone, Decadron, and Solumedrol are probably your most common pre-hospital medications. With this, there are a lot of side effects that could happen, so it's not something just to give willy-nilly just because. It's something that you need to make sure the benefits are going to outweigh any risk there. Typically, patients don't do very well on long-term steroids. Long-term steroid use has a lot of side effects that can occur there. So, with your Solumedrol, okay, this is a corticosteroid, of course, as the other one that we're going to talk about, but it's going to be an intermediate acting steroid. The onset depends on how it's given. Is this oral? Is this parenteral? How is this given? But it doesn't last very long within the body. Your indications: severe anaphylaxis, your asthma, COPD, urticaria, or hives, which kind of goes along with that allergic reaction. There are no major contraindications when we're talking about the management of anaphylaxis. Your dose, 2 milligrams, that's a typo there, it's supposed to be mg, 2 milligrams per kilogram with a max dose of 125 milligrams, and this can be given IV or IM. But the IV is preferred when you have severe anaphylaxis or severe asthmatic reaction. Precautions: we're just giving one dose. We're not going to give multiple doses in the pre-hospital setting. Long-term, prolonged wound healing, GI bleeds, that kind of stuff. So there are some pretty nasty side effects long-term. Short-term, usually not that many nasty side effects. Now, your other one that you probably will see in the pre-hospital setting will be dexamethasone or Decadron. Right, it's an anti-inflammatory, and it is an intermediate to long-acting, and this is a fairly common medication used with anaphylaxis and severe asthma. Not your first line treatment, of course. Your epi, your diphenhydramine, that kind of stuff, that's going to be your first line, but this comes in to hit that inflammatory response after you've gotten the initial drugs going. You also will see it for asthma, COPD. Some places may use it for extubation, but that depends on your protocols of your local, wherever you work. All right, no contraindications in the emergency setting. Your dose for this is going to be 0.6 milligrams per kilogram. It can be given IV, IO, or IM up to a max dose of 16 milligrams. Now, if you have acute mountain sickness, then you're looking at 4 milligrams every 6 hours until the symptoms resolve. And if you've got the high altitude cerebral edema, you're looking at 8 milligrams followed by 4 every 6 hours until the symptoms resolve. Precautions, same as the other, long-term use, prolonged wounds, wound healing, GI bleeds, that kind of stuff. Be careful if the patient has impaired liver for whatever reason, and typically, unless they're in extraordinary circumstances, most of the time we're just given a single dose in the pre-hospital setting.